Tonight, new developments involving children and a rare inflammatory syndrome that could be connected to the coronavirus. Children's Mercy confirms that they are treating one child for pediatric multi-system inflammatory syndrome. I spoke with a doctor from Children's Mercy about it.
This has been on our radar for a number of weeks now as we're hearing our reports from our colleagues across the world.
Dr. Jennifer Schuster says that children of all ages have been diagnosed with a mysterious inflammatory syndrome that could be connected to COVID-19.
Some people are reporting severe vomiting and diarrhea. Some physicians are reporting unusual rash. Some are reporting significant trouble breathing or problems with their heart as well.
Some of the symptoms are similar to Kawasaki disease. Dr. Schuster can't talk specifics about the child being treated at Children's Mercy, but she says the syndrome is rare and there is still a lot to learn.
We don't know if this is a direct effect of the virus or if this is something that's happening after you've recovered.
Some of the children have tested positive for COVID-19, while others...
Some of these kids are actually testing negative for the virus by nasal swab, but when we look in their blood, we see antibodies against the virus. So that means that they did have the virus sometime in the past, but they've actually recovered from it now.
The majority of cases are in New York, but children's hospitals across the country, like Children's Mercy, are starting to see it, which is why Dr. Schuster says,
this is a reminder that we're still learning about this disease and to be vigilant. Practice good hand hygiene, wearing a mask when you can't socially distance yourself, staying at home when possible, and continuing to be mindful of this disease is still out there.
And here's also when you need to get immediate care for your child. If your child has signs and symptoms of dehydration or they're not acting normal, like not waking up properly and they're lethargic. Also get them care if they have trouble breathing or have a fever that cannot be reduced with a fever reducer like Tylenol.